President Trump is using the power of his pen to deal another blow to Obamacare. On Thursday, he signed an executive order designed to lower premiums and allow Americans to buy insurance through large group plans. He also announced he was ending Obamacare subsidies to insurance companies. Here with me now is Texas Congressman Michael Burgess. Thank you very much, Congressman, for talking to us.
Thanks for having me on, Julie.
So does this Obamacare subsidy cut, I guess, hand a new problem to Republican lawmakers as if they need more?
I don't think so. I think if nothing else, it provides the impetus for the fact that we've got to move on this. Now, I will tell you, on the House side, we put a lot of energy, a lot of work into getting a product over to the Senate. It happened in early May, and it has been discouraging. It's been dispiriting that now it can't seem to move forward in the Senate. Perhaps this provides the catalyst to actually get something accomplished.
President Trump says that he doesn't want to help insurance companies get rich. The question many are debating is, by doing so, is he hurting the poor? Can you answer that for us?
Well, number one, the insurance companies are always going to do well. That's the way the system is designed. So don't cry for me, Argentina. The insurance companies are not going to have a problem here. Here's the thing with the Affordable Care Act. When it passed, I mean, I said back then it was designed to fail. Here's perhaps what I didn't realize as acutely, and I read this the other day. Someone wrote that with Obamacare, there's no alternative and no escape. That's the way it was designed. So there are going to have to be carefully constructed policies to minimize the collateral damage that people experience. At the same time, we have no choice but to go forward. For everyone who was helped with the Affordable Care Act, there have been 2 people hurt, and those 2 people deserve our attention the same as the one who was helped. Okay,
so to be clear, does this or does this not hurt the poor by cutting Obamacare subsidies?
Well, number one, it doesn't have to. If the agency just strictly focusing on the executive orders that were released, as the agencies revise the ERISA rules to allow for people to join together in association health plans, that doesn't have to, no way is that going to hurt the poor.
So this isn't really a done deal then, is what you're saying, is it doesn't have to, so that there is room for negotiation, and that's the point I'm trying to get across here, because the president calls Democrats obstructionists and is imploring them to come to him to negotiate a better plan. And it seems to me, because he calls himself a negotiator in chief, is that this is a negotiating tactic to get Republicans to finally step up to the plate and get the job done they've promised and failed to do, and that is repeal and replace Obamacare. If this doesn't scare Republicans into it, I don't know what will.
You know, and that is exactly the point. And I think the president, in many ways, this was an elegant solution to what seemed like an intractable problem. Literally burn the bridges, and now you've got to march forward. And in truth, both sides have to work together on this. I don't disagree with that. The fact that the Democrats did not want to work with us from the very first of this year was painfully obvious to me. Right. But there are places where we can work together, and I think we have during the year. That model needs to be followed.
Texas Congressman Michael Burgess, thank you very much for talking to us.
Thank you.